All right, I'd like to call the Board of Health meeting of February 2nd to order at 6:02 p.m. All members are present. Barbara, I just, before we get started, did you get sworn in for the Board of Health?
Yes, I did.
Okay, just wanted to confirm it. I just couldn't, I saw you at Town Hall. I just didn't know if you were conducting that business, so thank you. So I'd like to start off the meeting for citizens' participation. Mark, are you?
Yeah, might as well. I saw it early, but I figured, why not? Happy February with a 16 inches of snow that welcomes us to. And I got one person I want to thank through the chairman, Mr. Ed Berman. I saw the rebroadcast of the Ashland Around the Clock. You were there for the high school opening for the test site. Any good numbers out of it since that site date of what, January 7th, was it? Because it was broadcast on the Around the Clock.
Mark, Ed's going to give us a COVID update in a few minutes.
Okay, so we can just say that the high school is still steady on the ground and not vaccinated, but fully staffed. Okay, let's leave it alone. I'll leave it alone from there.
Awesome.
I'll second Mark's thanking of Ed Berman.
Yeah, we'll give Ed kudos. All right. Now peel that off the ceiling. No, I'm just kidding.
Is there a raise involved?
We just want to make sure you stay with us. All right, moving along, I would like to formally welcome Barbara to the Board of Health. Thank you for stepping up, and I know you've been to a few meetings. I will do my best to explain things to you, explain things in general, but please, if you have any questions, just let me know. And then I know it's a learning curve. We've all been there, so it's a learning curve. I know you've been to a few meetings, so you're familiar with some of the process, but being a board member, we all respect everybody's votes and opinions. So again, if you have a question and you need something clarified, just feel free to speak up and we'll be glad to clarify it in more detail for you. So again, I'll just try to put a little bit more detail into it for you so you can follow along and again, vote as a member and make sure you're confident with your votes. So welcome aboard. Do you have anything you'd like to say?
No, yeah, just thank you. And I'm just grateful to be here. Of course, the first day after I was sworn in, all the emails started coming. I'm like, but most of them are interesting. So, it's stuff that you need to know.
Yeah, and again, if you have, if you get an email and if you have any questions, of course, feel free to reach out, to me or to Laura to clarify things, or of course, even with Sergeant Berman, if you had a question about some of the numbers, because I know that's a lot of data that we get as well, just feel free to reach out.
Yes.
So welcome aboard.
Welcome.
Okay, moving right along, Ed, Sergeant Berman. I know we always call you Ed, but Sergeant Berman for COVID updates.
All right. Well, what do you want to know? No. All right. So a lot going on, everybody. Well, I'm going to hold off on the vaccine part toward the end. So our numbers are coming down a little bit, which is what we expected, post the holiday. I am kind of anticipating potentially a little bit of a bump again with February school vacation coming up as people travel. We've definitely saw, because we were tracking all of our students that traveled, and we definitely saw increases in numbers of those people testing positive after travel out of the state especially. One of the things that we are seeing right now, which I'm finding really interesting, is we are actually seeing significant household spread. So one person's becoming positive in the house, and then we're very quickly seeing the other people in the house test positive also. But what's really interesting is, for example, you can have a house of 6 and 5 of the 6 are positive, and that 6th one never becomes positive. Really interesting. I'm kind of watching that. As you know, the schools went back to hybrid. That's been going really well, except obviously with the snow, they had half days. Now, let's talk about the vaccine a little bit. All right. So 3 weeks ago, we formed a partnership with Holliston Public Schools and Framingham Public Schools. And working with Kitty Mahoney and the superintendents from Holliston and Ashland, we came up with an idea that during school vacation week, if we could get vaccine, our goal was to offer vaccination to all of our teachers and school staff, including crossing guards and school bus drivers for the 3 communities. We had already secured Keefe Tech was going to be our location, and Ashland High School was going to be our backup location. We had 3 days ready to go, also with a snow day, in case one of the days it snowed. Framingham basically was doing a lot of the paperwork for us for the vaccine, and just as we finalized our plans almost, they changed what phase 2 was going to look like. So it became 75 and over, then 65 and over, and now those school personnel are at that 3rd section of phase 2. So we found out last Friday we are not going to be eligible for a vaccine for a clinic for all of our school staff for the February school vacation week. We tried. A lot of work in the background, and we really were hoping that we were going to be able to get this going. In the meantime, while we were planning that, I want to give a shout out to John Brovelli at the fire department. He did a 2-hour training that I also attended to see how it was. We did a 2-hour training to train all of our paramedics at Ashland Fire on vaccine administration. So they've all been okayed. So in the event we can eventually have our own clinics and things like that, we have the ability to use all of our paramedics in town also. So that training has been done. Now, for the last 2.5, 3 weeks, I have been trying to get us vaccine for Ashland. So ran into a few stumbling blocks. The first thing I found out that I needed to do was I needed to apply, and Ron, I'm sure you'll appreciate this, I had to apply for my own NPI number, representing the Board of Health. So I did all that paperwork, finally got that. I did our application for Prep Mod, which I'll talk to you a little bit about that. We should have our access into Prep Mod tomorrow, hopefully. And when we went to order the vaccine, it looked like our order went through. And then on Friday, I got a call from DPH saying, "What are you doing?" And I'm like, "Trying to order vaccine. I have the ability, and at that point, just so you all know, we were trying to order the Moderna. Okay. So she said, "We still have you partnering with Hopkinton, Sherburne, and Westboro, because remember, we partnered with them for our first responders." Right. So DPH says we would prefer for now if we stay in that partnership. Perfect. I'm okay with that. Great. More people, to help out. So just as these conversations were going on, John Brovelli, I spoke with him again, and he said, "Hey, Ed, I wonder if we could get any Pfizer vaccine." I said, "Well, but nobody around us has the freezer that we can, to store it, at the -70 to -80. He said, "Hey, I think MadTech Corporation may have one of those freezers." So I said, "You know what? Let me find out." So I called over there last week and spoke with them over there. They have 3 of them. And they offered very graciously, if I can get the Pfizer vaccine, they will house it for me there for the 3 towns as part of our partnership. So on Friday, we notified DPH that we had that storage capability. Yesterday, Hopkinton Board of Health Director Sean McAuliffe, who I'm working directly with to try to get this, because he's the main of the towns that merge together. He's going to be like our main hub. He placed an order for 1,000 doses of Pfizer on Monday, because you have to order them in batches of 1,000. Now, we have to now figure out how we do our clinics. So what we've done, just so you all know, over the last couple of weeks, all the departments, and Laura's been helping with this really great, Diane, Senior Center, what we've done is we've started a list. We're sharing a spreadsheet. So if any citizen who lives in Ashland over 75, it calls up and says, hey, can you let me know? We've created a list. So we have people that we can call back. Now, we're also directing those people, yes, we're going to put you on our list, but we also encourage you to look for other avenues in the meantime, because I don't want to promise people something that we might not get right away. So I know we have directed people to the mass.gov site and to their primary cares also. And then, if they were able to get their first dose when we call them, great, we'll just go on to the next person. So what our plan is for now, if we do get some doses in, obviously we'd have to split them up with the other towns. We would work through that list first, and then we would partner with Hopkinton to come up with clinics. And we would work together hand in hand, because that also gives us those extra amount of people that we're going to need to help run a clinic. I have done Ashland's application and everything for PrepMod. What PrepMod is, the state signed on with this company so that people would be able to use PrepMod to sign up for one of our clinics, but they in turn will also do the billing of people's insurance. And then when those monies come in, we can use those monies to pay our, like for example, our firefighters who are going to be doing vaccines or to help pay for people. It's like almost like a revolving account that I'm going to work with Brittany to set up. I'm supposed to have my access into PrepMod tomorrow, and I've already done the application for Medicare and Medicaid and Mass Health for reimbursements. In a nutshell, that's kind of what's been going on.
Great job.
Just to circle back, I know we've talked about this, but I just want to make sure I have it down. So it's Hopkinton, Holliston, and Sherburne that we partnered, correct?
And Westboro.
And Westboro, thank you. Okay. All right, does anity have any questions?
Yeah, I have a couple of questions.
I'm just hold on one second, KJ. I'm just going to go in order of the board members,
okay.
just keep it a little orderly. Chris, do you have any questions for Sergeant Brown?
I do, not so much on what you spoke of, Ed, but similar. Here's an interesting scenario that I'm curious about the answer to. You have someone that's fully vaccinated. They've had both doses. They've gone through the period after of waiting so that they're at the full potency and all that kind of stuff. And at some point, they come in contact with someone who is diagnosed as positive. What's the protocol?
Right now, CDC says they have to quarantine.
That's what I thought. Okay.
Because remember, you know, it's not a 100%.
Right.
So for now, will those change? I think eventually they might loosen that up a little bit. Mm-hmm. But right now, no, it's deemed a close contact, and they have to quarantine.
Okay. Yeah, there's not enough. I don't think there's enough information about that yet, and I think those are questions that are starting to come up. So.
Right. Yeah, and then we do know. If you remember, everybody, I did order some a little while ago. I ordered some antibody tests, and I've had some people that I've kind of been keeping an eye on to see how long they have antibodies after they've been a positive. And I've had a couple people that have already dropped off. They have no antibodies left. And one other thing, if anyone's listening too, I want to remind people too, even if, once these vaccines become fully available, if you've had COVID, you still need to be vaccinated.
Thank you. Ron? you have any questions?
Yeah, just kind of along the lines of Chris's awesome work with, actually putting everything together, applying for all the numbers that you need, Ed. That's unbelievable. As far as the kids going away for school, is there a protocol when they come back? And what is that then? I mean,
Yeah.
do they have to quarantine for 5 days, get a negative test, or they can't go to school?
It's 10 days. They actually have to quarantine for 10 days and produce a negative test. And we have a travel form that they're required to fill out. And the nurses in each one of those buildings, they are monitoring that and in contact with all of those families automatically.
Wow. And then just to piggyback what Chris had asked you, even if these kids had both tests, the procedure and protocol would still be this. I mean, both injections for the vaccine, it would still be the same. Is that correct?
For now, yeah. Yeah.
Okay. All right. Thank you.
KG?
Oh, yes. Question is that I know that there were some calls to get the vaccination for all the nursing home as well as restaurants things. Have they been already did that? So
yes.
those people are off the list that you prepared for the seniors. Is that right?
Yes. So just so everybody knows, everybody at Waterview Lodge, staff and patients have been vaccinated. Remember, the nursing homes and congregate care settings were required to partner with CVS or Walgreens. The Waterview Lodge used CVS. They were phenomenal. I went over there to watch how they were doing it. The residents at Valley Farm were done a week later by Walgreens. And last week on the 27th, CVS was at Mill Pond Rest Home. So, yep, our 3 congregate care settings are done. I do know that Ashland Commons and Ashland House I spoke with some of them today. They are making their calls to CVS and Walgreens to try to partner with them to have their buildings done.
So they will be off the list that you're carrying for the seniors. Is that right?
If they're able to make that partnership and make that work, yes. But for now, I'll leave them on.
Okay. The other thing is that when you say 1,000 doses, the doses or the vials that you're talking about?
I'm sorry, you broke up, KG.
Is that 1,000 vials or 1,000 doses?
1,000 doses. That's all you're allowed to order at one time.
So that means only 1,000 people.
Correct.
Okay. So do we know the number of seniors 75 plus and 65 plus in town?
1,200. Approximately 1,200.
So we assume that
just to be clear on that, that's not all coming to us.
Right, I understand.
Okay.
We assume that we get 200 per week. Is that right? Or share?
That's what I'm hoping.
I will share. So it will take at least 6 weeks for the seniors to get over with it.
Right. And then hopefully when this Johnson & Johnson vaccine comes out, that's going to put more vaccine out there available.
All right. So we have to engage with any other private nurses who are in the citizens here and doctors here? Do we have a record of them or?
So I've had quite a few people, KG, have called up to either volunteer or offer their services. And Laura and I have created a separate spreadsheet to keep track of all the people that are willing to help.
Okay, that's good. Thank you. Great job. And then I'm hopefully the Karen Spilka's office will push for a higher number of doses soon. So let's hope so.
Like I said, I feel we're really ready to go. It's just, we just need the vaccine.
It's true. Without vaccine, we can't do anything. Yeah. So I'm glad that we are ready. That's good. That's a big progress.
Mm-hmm. Barbara, do you have any questions for Sergeant Furman?
No, but I just wanted to say I'm just so impressed with all the work that you're putting in and to try to get the vaccine. And I was just wondering, if the nursing homes that are getting the vaccines through CVS and Walgreens, do they also have the same guidelines of how much they can order from them, or they just?
Yes. So when they how they did it with CVS and Walgreens, those 3 facilities. So, for example, let's say Waterview Lodge said they had 100 people. So that means CVS had to guarantee them 200 doses. So they'd have the 100 for the initial, and then 3 weeks later to get their second. So that's already been configured.
Okay. Yeah, because that was going to be my other question too, because I remember the meeting that I think was last week, 2 weeks ago, about the vaccine that they were talking about, that some people were complaining that they got the first vaccine, but then when they went back to get the second one, like Walgreens was telling them they don't have a dose for them. So
right,
that becomes a problem.
Yeah, I believe with the nursing homes, they had to make a guarantee to them.
Okay. So hopefully we plan to do that with what we'll be getting. If we get it.
I'm trying. And by the way, again, everybody, I just really want to thank MatTech for, helping out, because they have the storage capability. What they're going to do is they've got 3 of those freezers. They're going to actually give us one to use in a secured area that's under 24-hour surveillance. And that freezer also has a backup generator.
Even if you store it there, how do you transport it to the site where you're vaccinating, and then would it stay for that long?
Yes, it gets transported with dry ice, and then you have 6 hours once you reconstitute. So we're good.
Good. All right, that's good.
All right, well, thank you. Now I can call you Ed. Thank you, Ed, for all of your efforts and hard work. I mean, I know I see you most days, but I mean, we from the board appreciate it, and I'm sure, speaking from the people that are watching, hopefully somebody's watching.
Yeah, and just one other thing. Yeah, one other thing I'll end in, just so everyone knows too, we're doing our own testing of our town employees if they've had an exposure. Whatever. We hit the 340 mark, I think it was today. So we've done quite a few in-house tests also.
Oh, good. That's great.
All right, Ed, we're going to move on. You're welcome to stay on. We have a septic variance at 6:20. We're a little bit behind. That's okay. Dan McIntyre is here for 46 Winter Street. Good evening, Dan.
Good evening.
How are you?
Good.
Good. I know you're used to this protocol, but just so you know, we have a new board member. Barbara is here, so we might get into a little bit more details just to make sure she understands the variances before she takes a vote. So if you want to just go over the property for us and the variances, and then we'll see if the board members have any questions.
All right.
Thank you.
Can I share my screen, or do you have the plan?
Laura can give you permission.
Yep. Hang on.
Okay.
Laura's the boss. So, well, Barbara, just to give you a little overview too, you might have seen this at previous meetings, but, and Dan, you're more of an expert in the state regulations, but Barbara, the Board of Health, we have our own regulations for septic systems and wells, and there's also the state regulations. We, as a local Board of Health, can give waivers to the state code as well. So, so some meetings you might hear them talk about the local regulations as well as the state regulations, but it's something that we do locally.
I think for you to share the screen, I'm going to have to make you co-host. Is that okay, Connor?
Yeah, I think.
Okay.
I don't think they. Yeah, you can make him a co-host, Laura.
Oh, he can request the permission, then you can grant it.
Okay.
Dan, you need to request the permission from the head.
I think I just did.
Do that?
Yeah, I think you can just go
You
ahead.
Go to the green folder and then click on it. It says share screen or something there.
He should be co-host now, so he should be able to.
All right, that's good.
There you go.
All right.
There you go.
Great. So this is an existing 3-bedroom home served by both a well and a cesspool. The cesspool is in the backyard over here. The well is on the side yard. It is also surrounded by 2 sides with wetlands. So the cesspool has obviously failed, and it actually collapsed last week, so we're currently under emergency order to get the tanks in. And tonight we're really talking about the leach field. So we selected the leach field area to try to maximize the distance from the well and maximize the distance from the wetlands. So we selected the side yard over on the right-hand side of the house. The tanks will be in the backyard and we'll pump over to the side yard. The soil conditions were probably not the greatest. There's a shallow ledge in this area. So we are asking for a couple of variances to the ashland regulations and one local upgrade waiver from Title V. What we are using is an alternative technology, the Elgins. They are approved by the Mass DEP for both a groundwater offset reduction and a reduction in size. They basically provide some treatment of the effluent before it reaches the ground. So this is why the state has provided those two credits. So the waivers that we're asking for under Title V is an offset to groundwater. We had a perk rate here of less than 2 minutes of inch, which would require a 5-foot groundwater offset. We're asking that to be reduced by 2 feet down to a 3-foot groundwater offset. And that is allowed by the DEP approval of the Elgin system. In addition, we are asking for a couple of ashland waivers. One is ashland requires 2 percolation tests. We performed just one because we had pretty much limited area where we could put the septic system. And the soils were consistent throughout that area. So we felt one was a valid test. We're putting the Elgins in a trench configuration, which is required in ashland, but ashland has a 10-foot trench separation requirement. We're asking that to be reduced down to 6 feet to conform with Title V. Again, we're doing that because we have limited area of suitable soils to put the system. And finally, the offset to wetlands. Ashland has a requirement to be 75 feet off of wetlands. We're asking that to be reduced down to 57 feet, which is in conformance with Title V requirement of 50 feet. There's really no place on the lot that's going to get us 75 feet and stay out of the well radius. So I think we've located this, I think it's about the best we can to try to meet all the requirements. If there's any questions, I can take them now.
And I just had a question for you. Is there a reason why you didn't or not asking for the garbage disposal as well?
Well, we had enough room to do it, so I figured that's one less waiver.
Okay.
And I don't want to undersize the system either because I just don't like to make the system too small.
I respect that. So, all right, I'm going to go in order of board members. Chris, do you have any questions for Dan?
I don't. Thank you so much.
No problem. Ron, do you have any questions for Dan?
I mean, it sounds like, you know, he's getting as close to the requirements as possible. And it sounds like our requirements are actually more stringent than the state's requirements. So
that's correct. Yeah. Yeah.
So it sounds reasonable to me.
Okay. Thank you. KG?
Yes, I do have questions.
No
then did you, is the in-ground pool still active there or functioning?
It is, yes.
And is there a setback for that with respect to the leaching field?
There's a 25-foot setback to leaching field.
Is that what we have or we don't have?
We have a little bit more than that. What you see there is the fence, but the pool is set back from the fence quite a bit.
Okay, so do you know what the exact setback that we have?
I don't have that figure right in front of me, no.
Okay, once you get all the waivers, can you submit a copy with the setback marked so that
We don't have that. We don't have, Dan, well, I'm asking Dan, but I don't think we don't have the setback in our regulations. Is it in Title V?
It's a Title V requirement. Yes.
It is.
Yeah.
Pool, because pool is, people use it, so it needs to be clean enough.
And
so
I can add that to the as-built plan when we submit it, so we make sure.
Right. And the other question that I have is, I looked at the elevations of the leaching field is 233. So the elevations for the pool side is about 230. So it's going down. So that's not going to be any infiltration of the liquid pass when it goes to the system. And what is the separation between the percolation pipe and the top surface? How much surface do you have in that area?
We have a 3-foot offset to the seasonal high groundwater table.
Okay, so it's from the top surface is about 3 feet down. Is that's what you're saying, right?
That's from the bottom of the trenches to groundwater, right?
Yeah, the bottom of the trenches to groundwater is about 3 feet. The trenches are buried about 1 foot to 1.5 feet.
Okay, so
we are mounting up that part of the yard.
All right. And the well and the septic tank, are they within the setback limits, or there is no setback limits for the well and the septic tank?
It's a 50-foot setback between septic tanks and wells.
Okay.
And we're at 55.
Good. That's good. That's all the questions I have. Thank you.
Thank you. Barbara, do you have any questions, or do you need anything reviewed a little bit further for you?
No, I don't have any questions. Thank you.
Okay. So it's whoever wants to make a motion. We can do it individually, or we could do them together, because there's no deed recording required for this.
Yeah, I make a motion that we waive as explained by Tom Ryden's letter.
I'll second that.
All in favor?
Aye, KG.
Aye, Diane.
Aye, Barbara.
Thank you, Barbara. Okay, that is unanimous. All right, thank you, Dan.
Well, thank you very much.
Thank you.
Have a good night. I mean, you're welcome to stay on if you want to.
I'll see you next week.
The offer.
I'll see you next week.
KG's on Concom, so he'll see you next week.
Oh, that's right. We're going to conservation next week. Yep. Thank you.
Thank you.
All right. Have a good night.
Good night.
All right. Moving right along tonight. So Barbara, just to explain, you might have seen this at the last couple of meetings. I've been trying to put things on under consent agenda, which just basically means that we're acknowledging we know about it, we see it. And if there's ever anything listed under the consent agenda that you want to pull off and actually discuss, that's not a problem. I think we went over this before for the rest of the board, but if everybody is all set with the consent agenda, I would like a motion to.
What all do you have under that? I didn't see the list, if you don't mind.
I can read it. Sure, I can read it. We have the budget FY21, the minutes from November. Excuse me. Slow down, Diane. Minutes from November 17th, 2020, December 1st, 2020, and December 15th, 2020. Board of Health Agent Director position, accepting resumes and interviewing. I don't have an update on that.
Okay.
Hopefully at the next meeting. The IMA with Framingham, again, don't have an update on that. Members that attended the sheltering training on January 14th. Members attended decisions at every turn meeting on January 12th.
So why are they being under the consent? Consent is to approve something that's already listed. We are not approving any of the other things, right?
Right. So basically what the consent agenda does is we take a vote to actually move it, to approve it, if you will, that you've seen it and acknowledge it and move on.
Okay. There was only one item that I had a correction, which I presume Laura has made it. The adjournment was 400. I presume Laura has made that. Is that Laura for November?
No, I responded to KG that the.
But I was away, but the remaining 4 members were there at that time, isn't it?
No,
Judy was not there.
Judy was not there.
Okay.
Yeah.
All right. I'm all set.
Yep.
Thank you,
Okay.
Diane. I'm okay.
Okay, no problem. But in general, like you said, if there's something like that we want to discuss, actually pull out and review, talk about in depth, we can. I just want to keep some of these things on to make sure everybody's aware of things that have happened.
if we approve the consent agenda, that means we are approving only those require the vote to approve. The remaining ones which do not have any information are not approved here, but it's being carried over next time. Is that what you're saying? Is that right?
you
Like the
actually
IMA,
lost me there, I'm sorry.
IMA, we don't have anything to say about it now.
Okay.
So we are not approving anything on that one. That is not part of the approval. That's what I'm saying.
Nope, this is basically just having the things on the agenda and
Okay.
acknowledging that you know about them.
All right.
Some of these items are going to fall off the training,
Okay.
the decisions at every turn meeting. The other items, of course, the minutes, that's going to change. So it's every month, it's not going to be the same consent agenda.
Sure. Okay.
It's just in general, we wouldn't need to discuss like the budget. It's everybody looks at it and says, yes, move on. The minutes, yes, move on. Like those are things that we usually just kind of give our head nod, okay, move on. So it's just to keep things flowing, not for any.
Right. Efficient way to do it.
Right. So would you like to make a motion after all that?
Somebody already did that. Chris?
Yeah.
Is that right?
Oh, I'm sorry. I didn't hear you, Chris. I apologize. Okay,
That's
do I hear a
okay.
second?
You're not paying attention to Chris.
Listen.
It's too bad.
I'm back. I told you I was off kilter for a little bit.
All
Now I'm
right.
back.
I take the pleasure of seconding that if nobody has done it yet.
All in favor?
Hi, KG.
Hi,
Hi,
Chris.
Diane. All right. Okay, so discussion agenda items for the next meeting, which is February 16th. I will have on for discussion, hopefully, the Board of Health Agent Director position. Hopefully that will be, like I said, an actual discussion. It will not be under consent. The IMA, I'm not sure where it's going to fall, but it will be on the next agenda. I would like to talk about the Medical Reserve Corps. Again, I know Judy was active in that, so I just want to pick up from that at the next meeting. Does anybody have anything else that they can think of now? If not, you can let me know later, but for items to discuss or under the consent agenda for next meeting.
Question on IMA. Has the attorney, the council has already seen that or not yet?
Yes, we're actually waiting.
But that's where we left it because we approved it. We left it for the town council to review it and then move forward with it.
Yep. So just so you know, we sent it to council. She has approved it.
Okay. So now we have to wait for the chiefs of the town to take care of it.
Right. It has been on there. It's on their agenda again for this week. We are waiting for the city of Framingham to get back to us. They have had change of guards, if you will.
Yes.
Sam Wong retired, moved on from the city of Framingham. And we just need to make sure that the agreement is still valid. And we have not heard back. So therefore the select board has not approved it. So hopefully, I'm hoping we'll get a response because it's on their agenda for tomorrow night for them to approve it. We're just waiting for them to get back to us on their intention.
Yeah. Did we get all the paperwork from all the restaurants and other food vendors for the license renewals for the 2021 already? All right.
Yes, we did. Yep.
Okay. All right. Thank you.
Diane, is it around now that we talk about the Mary Mortensen Award as well? Nominations.
Yeah.
No, I think in April, May, I think.
I think it's I think we actually give out the recognition in May, right? So
Yeah.
I feel like it was around this time we start talking nominations.
Okay. Well, I'm glad you brought that up. I mean, we can start that process if you want.
Sure.
We can put that on the agenda for the next meeting. Anybody have anything else for the meeting?
Di, any concerns? And I think everything seemed to be pretty normal with the House Street, monitoring wells as well as vents. All that stuff looked pretty good to me, but I don't know exactly what I'm looking for. I can read it, but was all that good to you? So we don't need to review that?
I have to say that I do rely on our consultants that review that because even though I've seen the stuff for many years, they're the professionals. They have not notified us that we have to take any action.
Okay.
The warning comes when only there is some certain level of that methane output. it has to be a ratio between the air and the methane. If it's
But I
within
think
certain
they
limits,
call,
then
they actually do call it burping. It's a natural, no, but it actually is, but it's actually a natural process of the landfill. But like Paige is saying, there's a formula. And if,
right,
if
it
the
lists
formula
there.
is not correct, that's why we've had to do
If it
mitigation
is
work.
too much methane, it's okay. It's too little methane, is okay. But if there is certain level of mixture of air and methane, is not good. So that's when they send warnings out for the neighbors too, I guess.
Okay.
So that has not reached. That's why they marked it at the end of it, saying that it's only this much.
Okay. Thanks, KG.
Dr. KG. he knows a lot about that stuff. So
well, I had to go through that one to read it and find
what's
out.
the temperature in Mars? I know you know.
What is it?
Right?
What is it?
I said, what's the temperature and was it Mars?
Oh yes, that's right. We do. It can be cold.
Yeah, I was gonna say he's laughing at me, but I know he knows the temperature.
yes.
All right. Well, that was actually a short meeting. Does anybody have anything else for the next meeting?
The only other thing that I didn't know if, she had asked, but it's always, especially if we have time and Cece has time, it's always nice to kind of hear an update from her, especially with all the emails she's been sending us. To know if that was of interest or not.
So and if she's watching, I hope she's watching. So I spent quite some time talking to Cece on behalf of the board.
Oh, good.
The end result of the conversation was that she wanted us to set up a committee to educate the Ashland residents on how to properly use Wi-Fi and communications, for that matter. I explained to her that I did not feel that it was in our purview to have a committee. I suggested maybe she might start it because she has the knowledge.
Yep.
I also think that we don't have any jurisdiction over it, so I don't know that we want to focus our attention on something that we don't have jurisdiction on.
Maybe better for her to put a guidebook or something like that and put it on a web somewhere so people can read
So
off.
when Cece and I had a very lengthy conversation, I explained to her, I think, because she has all this information and it's great information. So she was explaining that she has given it to even other states. She has given it to representatives from different states. Even our state was going to print it, with her information on it. And she said, then they changed it and they did something different than they said they were going to do. I explained, I thought it was concerning because I don't know the answers. Like, why didn't they do what they told you were going to do? And why aren't they pursuing it? Why isn't the states, the representatives, the federal government, why aren't these people pursuing these things that they have jurisdiction over? She didn't really have the answer. She was frustrated with the system. But that's why I thought that she has this information and she could probably do that locally and educate people. I know she got the meter through the library. So I explained to her, I just didn't think it was under the board's purview to actually have a committee to go and educate when we're not professionals in this. And
it's possible, but I looked at a couple of articles recently, which I sent it to Cece, and I'll share it with the board members later on. There seems to be some effects, but one needs to make a detailed search of it and do things. But these are two recent news that came up where there were some warnings from the Apple phone company about how to use it. And especially if people have pacemakers or something, shouldn't use it, all that stuff. But I'll send those articles
to
the rest of the board members. When it comes to health, we have a place anywhere we are because health is ours.
Well,
it doesn't matter.
Because clearly there's some discussion about it, I will be glad to put it on the agenda for next meeting. If you want to have Cece come and give a update, I just don't think there's any more that we could offer her for, she's done many things on local cable access. So if we want to have a discussion about this, I just don't want to keep going about it here. I will be glad to put it on the next meeting. I just don't know that it's.
I mean, we just need to be making sure that people are aware of these things. That's all. That's what we need to do.
We also need to provide information that if we're giving information, if we're making a choice as a board to provide information, then it's our responsibility to verify the legitimacy of the sources of that information as well.
Correct.
And that's why when she spoke to me and told me that she's passed on the information and people have dropped the ball, and she does not know why, I said, well, we need to figure out why the state is not doing anything, or those representatives for that matter. So, Chris put it in a better way that,
Yeah, the conversation has come up on the Facebook site that I moderate, and every time it's brought up by either CC or people that feel the same way as CC, other people who presumably are people who are engineers with science degrees and credentials negate those claims. Now, I'm not saying either one are right or wrong. I'm just saying that there's enough information on both sides of the picture that we'd have to, if we're being fair to everybody, we'd have to present both sides equally and disclaim the sources as well. And if we're not prepared to do that, then we should really just not have the topic.
Yeah. Right. If the sources of these are the manufacturers of the equipment that they do it, and then we may as well keep that on board. If they are the ones who
I think that she has some information that she's trying to get out to the public, and I think it's better that she do it individually and not go through the board to do it.
That's right. We need to verify.
That's kind of how I ended it with her.
Sure.
Yeah, and that's you couldn't have said it any better, because then people can say, okay, I'm interested and I want to learn more. Who are you to tell me this? What are your credentials? It's not up to us to vet, what her credentials or anyone else's are.
Right. And I just don't think that that's our focus, right now. So.
All right.
Okay.
All right. If everybody is.
Diane, does Barbara have, or Barbara, you may have known, a town email yet? So when I send my emails to the board, will she get those emails?
She does get your emails. Yep.
Okay.
Yeah. So if everybody is pleased, may I make the motion to adjourn, if you don't mind?
Second.
All in favor?
Aye.
My house smells so good right now. I can't wait to eat.
6:50 p.m. Have a good night, everybody.
Enjoy the food, Chris.
Thank you.
Bye-bye.
Bye-bye.
Everybody.
Night.
Bye-bye.
Bye, Barbara. Bye, KG.
Bye-bye.